and Assalamualaikum. My name is Dini binti Muhammad Shukri. My matric number is 070583. Okay, we chose for our assignment is Hepatitis B disease.
Hi, my name is Alya binti Amanuddin. My matric number is 070751.
Let me explain about Hepatitis B. Hepatitis B is a liver infection caused by the Hepatitis B virus. Hepatitis B is prevented by vaccination, HPV. When blood, semen or other bodily fluids from a person infected with the virus enter the body of a person who is not affected, hepatitis B can be transmitted. Among the signs we can observe such as stomach pain, nausea, fatigue and poor appetite. Hepatitis B is frequently a transient condition. Others may develop a long-lasting or chronic infection that can cause serious such as liver cancer. The best way to prevent hepatitis B is to get vaccinated.
Okay, let's move to how hepatitis B transmitted. Okay, first, through sexual contact. When someone having unprotected sex with an infected person, it can increase your risk of contracting hepatitis B. If the person's blood, saliva or vaginal fluid get into your body, they can spread the virus to you. Second, sharing needles. Sharing needles and the syringe contaminated with infected blood can spread hepatitis B virus quickly. Third, mother to child. Pregnant mothers who had hepatitis B virus can be delivered the virus to their unborn children. Almost always, the infant can be vaccinated to avoid contracting the infection.
Now I want to explain about the role of vaccination in preventing the disease. Vaccination can protect us and our child from many serious and potentially deadly diseases. Other than that, vaccination can also protect other people in our community by helping to stop diseases spreading to people who cannot have vaccines. Sometimes cause mild side effects that will not last long, cause some children may feel a bit unwell and have a sore arm for 2 to 3 days. Undergo rigorous safety testing before being introduced. They are also constantly monitored for side effects after being introduced.
Okay, now I want to talk about benefits of vaccination. First, the hepatitis B vaccine will lower your risk of developing liver disease and cancer by preventing hepatitis B infection. Second, it can help from protect people by creating an immune response without the harmful sickness. Third, vaccination can reduce your risk of hospitalization. Fourth, vaccination can put us one step closer to ending the pandemic. And the last one is vaccination can protect others, because getting vaccinated not only protect us, but it also protect people around you who can get the vaccinated yet, such as children and people with immune condition.
I want to talk about how vaccine works in providing long-term protection. We inject a vaccine, which is an injection of a weak virus into the body so that our body perceives it as a pathogen so it can be fought against, and next time the virus will come back into our body. Our body's antibodies recognize the virus. Macrophage or dendritic cells carry the vaccine antigen to the lymph node. When the vaccination antigen is presented to T cells in lymph nodes, effector T cells and naive B cells are activated, which starts the adaptive immune response. Activated CD8 T cells transform into cytotoxic T lymphocytes, while activated plasma B cells produce specific antibodies, memory cells, and cytotoxic T lymphocytes. When a true pathogen is detected, the plasma cells and memory cells are activated to attack the pathogen.
So, let's move to how vaccination works in preventing the disease. First, the patient receives a hepatitis B virus or vaccine formulation containing monophosphoryl lipid from the hepatitis B virus surface antigen. And then, the combination of monophosphoryl lipid and QS21 has activated the immune system. After that, monophosphoryl lipid bind to receptors such as TOR4 on antigen-presenting cell and has made a direct antimicrobial response. and migration of antigen-presenting cells carried to lymph node. This can increase co-stimulatory molecule and then the release of cytokines necessary from the activation and differentiation of T and B cells. And then, plasma cells release antibodies to hepatitis B surface antigen, therefore providing immunity to hepatitis B virus. Furthermore, T cell activation and proliferation are triggered by the recognition of the hepatitis B surface antigen in the absence of co-stimulation. Next, T cell release cytokine for the process of differentiation and reproduction of B cell into plasma cell. In the end, they are better able to analyze their behavior as well as that of others. They can learn a variety of talent through reading books, which also help them stand out in the workflow.